That's it. Good morning, everyone. Thank you for staying here, and thank you, the organization, for bringing the opportunity to present here in this Congress the new innovation in Catalonia. My name is Adria. I'm the communications manager of this department. TIC Salut and Social Foundation, it's an agency of the Ministry of Health in Catalonia. And our aim is to facilitate the digital transformation to the entities and companies. And I would like to present the most recent project that we are involved. We started this project 1.5 years, and now we are starting the pilot. And the project is called Marketplace Applications. And let's see in the next slides how it evolves. First, this is the agenda of this presentation. It's going to be 15 minutes, I promise, no more than this time, because there are plenty of speakers that want to speak, and I promise I will be with my time. So first, let's see the overview of eHealth in Catalonia. In our region, we are just handling more than 300,000 health, lifestyle, and well-being apps. It estimates that nowadays, every month, we upload, all the users and companies upload more than 40,000 applications every month. So there are a lot of apps to handle, and the professionals need to know which one are useful and which one are trustful. Moreover, 12% of the healthcare providers have health applications, and mainly focus on services as health centers geolocalization, visiting management, timeout and real-time, and virtual visits. In front of this amount of data, we have to focus in different kind of challenge. The first one, and the most important, is provide trust applications, because we are just facing that we are handling a lot of applications, and the professionals ask which one are truthful and which one are safety. Managing data, and if you download some application, you want to know as a user which application, what it's going to do with the data that is collecting. So we decide that we need to create an accreditation model. So as we can see here, the first solution is create this accreditation model. I'm going to explain in 2 slides what consists this accreditation model, but this is the first solution to face this challenge. The second challenge is, once I have as a professional, I have this application, I know that this application has passed an accreditation model, so how can I prescribe these apps to the information and the user? So we create the Absolute website, where all of these applications are put in this marketplace. The third challenge is, once I have the accredited applications, when I have all of the applications in one marketplace, the third challenge is, well, this data that is collecting, how we can make sure that every professional can have access to this data. So it's important to have a healthcare platform. The fourth challenge is, once I have all this data collected, I need to make sure that this data can be shared and can be shared with professionals and different institutions and public centers. So we need to make sure that all of the providers have access, and it's interoperability of this framework. And finally, once I have all these applications and the data and it's a trustful application, we need the most important, that is what the professionals can do with this data. So at the end, we have this interoperability and healthcare platform that it's called Absolute Marketplace, that is the project that I'm presenting. Well, for staying at right now that we are here almost in November 2017, but we have to go in the past and saying that we start this project in February of 2015. So at this point, we have a signature with a lot of entities implied, like health, welfare, and also the department, and different kind of entities as Mobile World Capital, And we decided that we need to focus in mobility, in eHealth. So 2 years ago, this plan was started. And after that, the foundation where I'm working, we decided to create this office, eHealth office, for giving answer to the different challenge. After that, we face with the accreditation criteria. We get a lot of entities like nurses, like physicians that want to be involved in this accreditation. And we decided to release the marketplace. This marketplace was released 1 year ago, and now we are facing the pilot stage. We are here. We start before the summer the pilot. We are piloting in 4 different primary care centers, and we want to present the data at the end of this year. And after the present the data, we are going to think about the scalability of this model. As I said, we have to accredit the model, and doing that is a public accreditation model. You can just access in the website. I have to say that right now the only language that is using is Catalan and Spanish. So we hope that in the future, in the short term, this data will be also for English speakers. At this point, if we focus with the gradation model, we have the 4 steps. The first one is if you are an entity or a company that are interested in involve your application in this accreditation model, you have to fill in an online request. This first online request is free, and it gives information about how your application is in terms of technology, usability, safety. Once you have the initial validation, we classify the application in 3 main areas in terms of security. We give some guidelines in terms of recommend, desirability, and mandatory, or that we say that if this information is mandatory, that it has to be because it's important that this application have this kind of information. So here, this presentation will be available, so you will see better these different points, but just summarizing its design, content, privacy, and technology. And finally, when this accreditation model is passed, you can see your application that it's published in the marketplace in the website. So, as I said, desirable, recommend, and compulsory, that's the main 3 areas in terms of security. And this is all of the ecosystem that creates. The first is the accreditation process with the website, and also this digital health platform where the data is involved. So, to understand all of this platform and this technology, it's important to focus that we are a user-centered model. So we can see here the patient, and Javier, in Garcia terms, he told that they are dealing with Salud, that is like eHealth. So our Salud, our Salud, it's our My Health. It's called La Meva Salud, our health, and it's in this point. Every patient has to go through this our My Health for going to the application like website, and also the physician, the professional, have all of this information in healthcare information system and the professional viewer. That it's called Catalan Electronic Health Record. Once this professional wants to recommend an application, he has to go to our electronic health record and log in, and after that, he can just recommend the application in the website. Once he has recommended the application, he only has to give his cell phone number, and after that, he can just send the application to the system and the patient. Once the patient receives this notification in our La Meva Salud, in his My Personal Health Record, he can just go through the application, go to the official marketplace, and receive this notification, and he can download for free the application. All the applications that are in this website has to be free. It's the first rule that we just focus, because we understand that it has to be useful and also accreditation for the patient. And finally, once we have all of this data, the professional can have access to the different data that the patient is generating. He can just see the different data. And the most important is that in this point, the professional has the last word, and he has to validate if the data that it's introduced is correct or not. If the professional checks the value and he thinks that this data is not correct, so he can just go at the bottom and say, he can go just at the bottom and say, this is not correct and this one is correct. And to summarize, the conclusion is that for users, we bring secure, informative, and share data with professionals. For professionals, this data is efficient and useful in terms of daily objective. For the providers, all of this information is integrated. For the healthcare sector, this data can help to predict and act in advance. And finally, for the industry, we provide secure and trust applications. So that's all. This is my contact. As the moderator said, I have to leave in 10 minutes, but I have time for questions as you mind. Thank you, everyone.